Hi, everyone. Thanks for joining us tonight. I'm Dr. Kyle Swanson with Dr. Rachit Shah from KSB Foot and Ankle. I'd like to take a moment to thank Aaron Fox and KSB Community Wellness for putting this event on for us tonight as well. Tonight, we'd like to talk about something that we see every day in our practice, toenails and different toe pathologies. So without further ado, I'd like to turn it over to Dr. Shah, and he's going to get started.
Thank you, Dr. Swanson, and thank you for everyone joining in tonight. So today we're going to be talking about a few common nail pathologies that we see in our clinic. First one is going to be fungal nails, ingrown toenails, and then dealing with nail trauma. We'll talk about the causes, the symptoms, treatment options, and lastly, the prevention of that. So one of the most common nail conditions seen by podiatrists are fungal nails. Oftentimes 10% of the adult population is affected, and it's usually caused by a fungal infection on your foot. And it's associated with usually when people are walking barefoot in saunas or locker rooms or any in public setting. And one thing to note is fungi usually like to thrive in dark and damp environments, oftentimes in sweaty shoes or boots, or people who work in wet conditions and have their shoes that are wet. Diabetics especially are at high risk for fungal infection as well. Some of the symptoms commonly associated with fungal nails are patient's nails are usually discolored, often white or yellow. They're thickened and brittle. The nails can be painful or foul smell at times. Some of the treatment and prevention is oftentimes we start off with topical or oral medications. We might even have to remove toenails sometimes if the condition is severe enough or it's causing pain. And one of the key things to kind of prevent it from coming are keeping your feet clean and dry, avoid walking in barefoot, especially in public showers, pools, or locker rooms, and not sharing nail clippers. Especially for women who are getting nail care done at nail salons, you want to make sure that those places are licensed and they sterilize the instruments. And properly managing your blood sugar levels if you have diabetes is equally important. The second most common condition that we see is ingrown toenails, and it's usually a painful condition experienced by a lot of people. And it occurs when a corner or side of your nail goes into the skin, as you can see on the picture on the right. It can be caused by cutting your toenails too short or on a curve instead of straight across, which can kind of dig into that corner, injuring your toenails, or having large or curved toenails to begin with. Some of the symptoms experienced with this is redness and pain along the side of the nail. You can see swelling around the toenail as well, and oftentimes infection can lead to some pus draining out from that affected nail as well. So some of the things you do to treat it is you can start off by cutting the corner of the nail to see if that releases the pressure and the pain. If that fails, you might have to go in and remove part or the entire nail. And you might even have to add a chemical to prevent that part of the nail or the entire nail from going bad. If the nail is infected, you might have to add antibiotics as well. But one of the ways to kind of prevent this from happening is wearing proper fitting shoes, trimming your toenails straight across instead of being a curve. You don't want to cut the nail too short as well. I'm going to hand this next portion off to Dr. Swanson, who will talk about toenail trauma.
All right, thank you, Dr. Shah. So regarding toenail trauma, this can be caused by a variety of things. One is stubbing your toe, dropping something very heavy on your foot as well, sometimes wearing shoes that don't fit properly, and then sports-related injuries as well. Injury to a toenail can result in a collection of blood underneath the nail as well. This is called a hematoma. And this could lead to causing an open wound underneath the nail, which can require further treatment as well. Some symptoms, you may feel pain or throbbing. You may notice dark red or purple spots underneath the nail. You may even have active bleeding from underneath the nail as well. A split or a tear in the nail can occur as well, and the nail could be partially hanging on, which can also cause discomfort. Treatment and prevention. It kind of depends on the extent of the injury. Sometimes we're able to clip or remove part of the toenail that has been injured. Sometimes we need to remove the entire nail if there's a lot of pressure underneath. If the bruise or the hematoma is about 50% or more, we may need to remove the entire nail to look underneath to make sure there's no cut in the nail bed or a possible break in the bone, which could even result in an open fracture, which could be very serious as well. This may require stitches if there's an open wound, and it's always good to remember to wear good supportive shoe wear. I wanted to include this slide as well. Our wound care center at KSB, if anybody does experience any toe wounds or injuries, be happy to help you. Even any other wounds, head to toe, we do have a team of providers, and we do take a comprehensive approach to healing. Our wound center is located on the annex first floor, and our contact information is listed there as well. So in conclusion, podiatrists see and treat many different types of nail pathologies and injuries. It is very important to identify the specific cause and symptoms so we can really dial in to each patient's treatment. Proper feet hygiene is extremely important. Changing socks every day and disinfecting shoes can help prevent some issues as well. And then making sure that we wear proper supportive shoes. And lastly but not least, if you do experience any toe issue or your toe happens to break down, you could always call the tow truck. All right, well, we'd like to thank you for joining us tonight. We hope that you learned something as well. Once again, I'd like to thank Aaron Fox and KSB Community Wellness, and we hope everybody has a fun and safe Halloween. See you next time. Thank you.
Thank you, everyone.